Drawing on the skin. It's how you got that awesome Stussy S tattoo on your skin in 5th grade. It's also something that your doctor might do. Let's get into it. Okay, doctors don't just draw on the skin for fun. We do it for a very specific purpose, and that purpose is monitoring of cellulitis. Cellulitis is a bacterial infection of the skin. It causes the skin to turn red, it gets painful, it can even feel warm to the touch. We've probably all experienced this, at least to a certain extent. Maybe you've cut or scraped your skin. You've noticed that the surrounding area tends to turn a little bit red. Some of that may have been due to a transient case of cellulitis. However, most of the time, our immune system will make short work of any bacteria that enter the skin, and we don't really get sick from it. A couple days go by, and the skin is back to normal. However, in some cases, we do get sick. And those are the cases that show up in the emergency room for hospital doctors like me to evaluate. And the first thing I do is, guess what? Pull out the skin marker and draw a border around the red area on the skin. Okay, that's not the first thing I do. At first, I'll introduce myself. That would be weird if some random dude just showed up and started drawing on your skin. So first, I introduce myself, and then after examining the red area on the skin, I'll draw a border around it. The purpose of this is for monitoring. Once the borders are marked, I can visually inspect this area every day to look for progression of the rash. If the red area recedes from the marked borders, the infection is getting better. If it expands past the marked borders, it could be getting worse. In this way, drawing on the skin can be a powerful tool for doctors. Okay, more on cellulitis. It comes in 2 flavors, purulent and non-purulent. Purulent cellulitis is when you have a pocket of pus or an abscess, and then there's red skin surrounding this. This type of cellulitis most often requires surgical drainage. If I see an abscess in the skin, I'll pull out my scalpel and okay, who am I kidding? I'm an internal medicine doctor, not a surgeon. I don't have a scalpel. Instead, I'll get on the phone and call the surgeon on call to evaluate for incision and drainage. This allows the pus to be drained and helps the abscess heal. Sometimes this is sufficient to treat cellulitis, but oftentimes, actually most often, I'll still prescribe antibiotics. The other type of cellulitis is non-purulent. So this is just a red patch on the skin, often caused by the bacteria Streptococcus. There's no abscess, no pocket of pus to drain, but it's still a bacterial infection that is likely to get worse if it's untreated. For this type of infection, I'll give antibiotics. And if it's bad enough, I'll order an intravenous antibiotic like 𝐂𝐎𝐍𝐿 to be given directly into the vein to make sure the infection is neutralized. And even then, I'm not done. Once I see evidence that the rash is improving and the patient can go home, I'll prescribe a course of oral antibiotics to be taken by mouth at home, typically for 5 to 10 days, in order to make sure that the infection is cured. Whew, so that's the basics of cellulitis and why a doctor might want to draw on your skin. There are many complications of cellulitis, including sepsis, bacteremia, endocarditis, that's an infection in the heart, and a really bad situation called necrotizing fasciitis, where you pretty much have a flesh-eating bacteria eating away at your soft tissue. But I'll have to save those for future videos. Until then, thanks for virtually hanging out with me in this video, and I'll catch you guys later.